Hello and welcome to Body and Mind Uncensored. We're your hosts, Kelli
and Taleese. Combining 26 years of nursing experience, we're dedicated to sharing our expertise in mental health and women's health with as many people as possible.
The topics discussed in this podcast are based on our educated opinions and real-life experience and should not replace advice from your healthcare team. Hello, Taleese. Welcome back.
Hi, Kelli. How are you? It's been way too long.
It has been way too long. We need to do better about getting a regular schedule.
We do. We both have crazy lives. I know that's no excuse. I mean, other podcasters, I'm sure, have crazy lives as well. But we're glad to see people are still listening.
Yes. Thank you for your support. We really do appreciate it. And we're both very sorry that we haven't been recording as much as we should.
Yes, we will try and do better.
So, Taleese, I have a question for you before we jump into our topic today. The last time that we caught up, you did your menopause test. Did you end up finishing it even though the instructions said not to?
No, because I did 2 tests and they kept saying the same thing. And so then I was like, yeah, I don't think it's going to be anything different. Okay. I think it was just going to say that the test just proved that I still had the follicle stimulating hormone in my urine. So I know that I still at least have that. So it wasn't a complete waste of $20. And that's what makes me ovulate, right? Like It stimulates my ovaries to release an egg, but it didn't tell me what stage I was in.
Okay.
So,
That's okay. Well, you live and you learn, and then you
just go to the doctor and you pay for real labs.
Yeah.
That's what needs to happen.
I guess. Yeah. So anything else been happening in your life that you want to share before we jump in?
Oh my goodness, so many things. Oh. You have things too, right? Like last time we talked, you were putting the vote away. I think that's what maybe.
I can't remember what we talked about. It was the end of, I had just come back from my last trip. Yeah. Yep. The boat's covered, the pool's covered, everything's ready for winter.
Winterized.
I'm not ready for winter.
Did it snow down there or is it? Because I got a picture from my daughter and son-in-law that they had the first snow out in BFE.
Utah County?
Utah County. Very far south, yeah.
No snow, just rain. I thought it was just going to be in the mountains, so I'm kind of surprised it made it to your daughter and son-in-law. But
yeah, it was on the freeway. He was on his way to work, and it was just flurries. But
wow.
So, anything else new with you? Kids doing okay? I see your daughter every now and then.
Mm-hmm.
She's going to school. You get to see her when she comes down.
Yep. She comes she's doing class 2 days a week in person, so she's traveling for that. Yeah.
Why?
Because where she decided to go to school, it's required for her math class. So, yeah.
Dang.
I know. Dang. But, yeah. Anyway, what about you?
We're finally in the 80s here. It's cooled down. Today it's actually raining. Quite refreshing. I don't think we've had rain since our monsoon season. Do you remember me telling you about that?
Yeah.
That was the last time we had rain here. So what about you? Same thing? Have you guys had any rain?
No, it's been pretty dry. It's 40 degrees outside right now, though. I'm not loving that. It's a little cold.
That is cold. No wonder it's snowing in Utah County.
Yeah.
So I will tell you this. I told you, I'll tell our audience that we've been looking at property up in some mountains, and they have a lot of snow today. We looked at the cameras, and they have quite so. You
moved away from snow, but now you want to buy property in snow.
Oh, no. That's the thing. We're not staying up there when there's snow. Okay. No.
Okay.
No, we're simply there for when it's 100 and teens here.
All right, that's fair.
So what brings us to this recording is that it's October, and October is Breast Cancer Awareness. We wanted to kind of talk about female cancers. Kelli and I have both experienced loss in our immediate family with cancer, so we both have routine checkups, and we wanted to talk a little bit about that since October is Breast Cancer Awareness Month.
Yes, and want to just start out by encouraging all women and even men, if you're at risk, to go and get a mammogram. So if you haven't done that this year and you're in that eligible age range, which is over 40, please go schedule a mammogram. It's very important.
Something that I found works, maybe we should tell our past first, or our history. I was going to say how we stay on top of our mammograms, but we should probably say why we've been receiving them and our history.
You can kick us off.
Yeah, I'd love to start with mine. So my breast cancer story, I should say familia breast cancer story. My mother, my biological mother, she was 28. Her and my father were 28 when they had me, and she developed breast cancer when I was little older than 2. That puts her at 30. Mm-hmm. And from diagnosis to when she passed away, it was 6 months. So it was very aggressive, as you can imagine, for somebody who's 30 to have breast cancer, to find out that they have breast cancer and just have a 2-year-old. That would be pretty hard.
That would be so hard.
Yeah.
Do they know, like, did she have it for a while and just didn't know? Or do you know her symptoms or any of that? Probably not, since you were so little, but...
Yeah, unfortunately, I don't know what her symptoms were or how fast it came on, like if she just felt a tiny lump and that was it. But because of that, I have been having mammograms since I was, I think, 2 years before her age, I think is when they recommended. I did participate in a Huntsman cancer study. Mm-hmm. And my grandma and I, so my biological grandma, my mother's mother, she and I, neither one of us had breast cancer, so they wanted to test us to do some genetic studies. And so they had my grandma and I both come and answer questions, about when you first started your period. When did you have your first child? Did you breastfeed? Did you, all those things that can affect hormones and women's hormones. So just been having mammograms.
So no other women in your family that you know of had breast cancer?
Correct. Mm-hmm. Nor have they since.
Okay.
We have had several other types of cancers, like ovarian, uterine, lung, that kind of thing on my mom's side. What about you?
Interesting. Yeah, so I was adopted when I was a baby, and my adoptive mother could not have children, so hence why I was adopted. And she...
So Kelly, can I pause you right there?
Yep.
So how old were you when they adopted you?
I was
brand new.
Couple days, maybe. Oh. I don't know that timeline. But yeah, it was pretty quickly after I was born. But my adoptive mother couldn't have children, and I don't remember how old I was. So I was a little bit older because we had adopted my brother when I was 5, and she developed, I believe, ovarian cancer like a year or 2 after we adopted him. So I was probably about 6 or 7 years old. And she did treatment for that. And they considered her in remission. And then maybe a year or so later, they came back and said that she had cancer again. And I've asked my dad, and he wasn't really clear. So I'm not sure if it was still considered ovarian cancer or if it was a different type of reproductive cancer the second time. But it came on with a vengeance, and unfortunately she did not recover from that one. And
how old were you?
It was right before my 11th birthday.
Wow. How much of it do you remember?
I actually remember quite a bit. I remember going to treatment with her. She would get ascites or fluid buildup in her abdomen. And I remember going, and they would drain it. They would do blood transfusions a lot, and I would go with her to do those. And then after we left the hospital, she'd take me to Iceberg to get a shake.
I do remember you saying that about Iceberg.
Those were my favorite. I mean, obviously not my favorite, but yeah, like just got to spend some time with her while she was going through her treatments and things like that. And that's one reason I wanted to become a nurse, is because I saw how the nurses took care of her and what they did for her when she was suffering.
Yeah, so I was just looking up on the stats for breast cancer. We've come a long way. Mm-hmm. I know when my mom was diagnosed with breast cancer, That was back in the 70s, and they removed, within 6 months, they had done a double mastectomy when it had already gone to her lungs. So I think things like that don't happen as often. That was a lot of, I'm sure, agony and pain that she went through just for no reason. It had already spread to her lungs. There was not a whole lot they could have done. But so I wanted to tell you about my experience with my very first mammogram. So when you go and have those, they kind of keep a track record of what your breast tissue looks like, if there are any changes, things that they need to look at. So they didn't have any previous images of my breast tissue. So I went in for my mammogram. They knew my history. They were very diligent about the images that they took. So they took the images, and then it was one of those where we'll call you back, or if you don't hear from us, everything looks good, which things have come a long way. When I had my first mammogram, that was, yeah, it was 20 years ago.
How old were you when you did your first?
28. You?
I think I was 40.
My very first one, I go and I have it done. I'm nervous anyway, right? My mother passed away from it. I'm a new mom. It's nerve-wracking anyway.
Yeah.
So they say they'll call me back. Or if I don't hear from them, they're okay. Everything's good. So I go about my business, and they call and they leave a message, a voicemail. This is back in the voicemail days on your phone, right? Before it was a problem with HIPAA, before it was so many things have changed, right? So I get home to this voicemail that says that there was something concerning in my imaging, and they want me to come back in. Keep in mind, I didn't get this message until it was a Friday on a 3-day weekend before a holiday weekend, like Memorial Day or the 4th of July. It was the 4th of July because I went during my birthday week. So anyway, I had to wait that whole long time knowing that I'd lost my mother to aggressive breast cancer.
Mm-hmm.
It was my first mammogram, new mom, thinking, holy cow, like this is what my mom must have felt, right? I had little kids.
Yeah.
But
I can't believe they left that on your voicemail.
I know. Things have come a long way.
Yes.
Things
Yeah.
have come a long way.
Definitely.
But it was kind of a long, aggravating weekend. But as we know it, everything was fine. I did have dense breast tissue, which I think is pretty common, especially for that young of age, and which is, I'm going to go out on a limb here and say that that's probably why we don't start mammograms until later in life, is because your breast tissue is so dense that I'm sure there are a lot of false positives, right? But I don't think it's a reason to just not do them.
Yeah, especially if you have family history.
Exactly. But they maybe could have warned me, right? Like this might be common. We don't have any mapping of your breasts. You've got very dense breast tissue. So long story short, they brought me back in. It was still there. What they were seeing still showed up on the mammogram. So then they had me do an ultrasound, and the ultrasound proved that it was just, they could get a different angle, and it was just dense tissue. So there you have it.
That's good.
Yeah. And every time since then, it's been that, it's still there, but they're still watching it, and it's just dense breast tissue. How have yours been?
I also have dense breast tissue, but mine have all come back normal. I have never had an ultrasound though, which I know that they've recently changed the guidelines on that for people that have dense breast tissue. My doctor has never really said anything about that other than you have a normal mammogram and repeat in a year or whatever. So that might be something next year that I look into. Because I have lost like 100 pounds, my breasts have changed a little bit. But my last mammogram earlier this year still said that I had dense tissue. So
Is your dense tissue getting better?
no, even with 100-pound weight loss, it's still dense.
I still have some dense tissue, but I can definitely feel my breasts getting less dense as I get older.
So because I did not know my biological family history, I have had genetic counseling as well and genetic testing, and everything came back as no risk. Luckily, because I did find my biological families a couple of years ago through DNA testing, I was able to confirm some family history with them as well. So both sides have confirmed that there's not any known BRCA genes or anything like that. So That's good, I
That
guess.
is good.
But I did get the genetic
So
counseling
you bring
before
up a
that
good point.
to
You bring up
kind
a
of
good
learn
point.
more.
So as you can imagine, somebody whose mother passed away when they were this young, they wanted to do the testing for years and years. Like when it did finally
Mhm.
come out and it was a routine test, like they were very like, you want to do this, you want to do this. And at the time, like not, I don't think it was well known, like there was this fear of it affecting your insurance, right? So I didn't want to do the testing because I was like, well, what if I do have the BRCA gene? Are they gonna am I gonna be able to get life insurance? Am I gonna be able to, all these
Mhm.
things? Is it gonna affect my health insurance rates? And um, did you ever have that fear when you were considering it, or you just wanted to know?
Luckily no, because at that time the Affordable Care Act had gone into effect, and so pre-existing was no longer a thing. But honestly, even if pre-existing conditions were a thing, I think I still would have wanted to
Mm-hmm.
know, just knowing that I lost my mom at a young age and I don't want to die and
Mm-hmm.
leave my kids without, or my husband. I would rather kind of know my risk factors ahead of time and
Yeah.
be prepared if at all possible. I know that there's been a lot of advancements made with breast cancer. More people are
Mm-hmm.
surviving breast cancer. I don't know what the mortality rate is right now, but I do know that they are able to treat and get it into remission a lot better now than they did back then. And same with ovarian cancer. Ovarian cancer used to be a death sentence. It still can be if it's not caught in time. It's one of the silent cancers. There's no way to feel for a lump in your ovary, or, some people just go without symptoms,
Well, and if they're
or,
like most females, I feel pain in my ovary when I release an egg, right? Or when I'm like
mhm.
ovulating. And so like that could feel like, oh my gosh, something's wrong. So there's so
Yeah.
many feelings going on down there that oftentimes we dismiss them as women, right? Like, oh, that's just
Yeah.
one more period pain, or that's attributed to this.
Um, it's also interesting to me too, after you've had a hysterectomy, but you still have your ovaries, they don't recommend doing
Mm,
your yearly PAPs and things like that. And so a lot of women,
mm-hmm. Me
me
too.
included, stop going to the OBGYN every
Everything.
year for a yearly exam. And I know somebody personally who had had a hysterectomy and quit going to her OB for an annual. She was told, you don't need to come back. You're
Yeah.
good. And she ended up developing ovarian cancer. I don't know the full details of her story, but something like they didn't think there was an issue and she kept pushing and pushing. And finally, they did some testing and came back that she had ovarian cancer. And it's something that if she had listened to her gut and had
Mm.
advocated for herself, they could have caught earlier on. Luckily, she is in remission now, but maybe she'll
Yeah.
come on and tell us her story. We'll have to see if she'll share with us. But there's been a lot of advancements, but also still some things out there that if you feel like something's not right, it's okay to advocate for yourself and to ask the questions and make sure if you're not comfortable with what your provider is telling you, get a second opinion, do some research and just see. Like, I mean, Dr. Google is not great most of the time, right? But our intuition tells us things sometimes. And I think it's important to listen to ourselves and our bodies.
Which maybe I should, because as I sit here and talk about it, and yes, maybe I have a very strong. I told you about that needle in my throat story, right?
Yeah.
So that's
I'm not advocating to be a
no, but it might come
hypochondriac,
naturally to some of
but
us. So when talking about that one ovary that I've got left and how I still feel myself ovulate. Like I'm feeling it today. So this is
mhm,
yeah. I should go have that one ovary checked because you're right. I don't remember the last time I went to an OB. I don't have my uterus. There's no reason to do a pap smear. I don't have one of my ovaries, but that other one could wreak havoc in my abdomen, especially since
mhm,
my other ovary was removed because it encapsulated the ovary. So we need to be advocating for that, for something that helps women. Even though you've had a hysterectomy, if you still have other parts, you should get those checked up because it could be full of cancer in there just because my other one wasn't. So what I do is I like to have my mammograms around my birthday. That helps me remember. I know I'm not the only one who does this. A lot of people do. But maybe get a group together and schedule them and go have them done. Whatever we can do.
Yeah, I used to have my yearly exam and my mammogram the same time or
Yep.
around my birthday. It is the easiest time of the year to remember, and it does come around once a
Exactly.
year.
It's
So,
a good
yeah.
reminder for all the things.
So let's talk about our first mammograms really quick because a lot of people who are listening to this might not be in that age range, and mammograms sound really scary. I remember the first time I heard about somebody's experience having a mammogram, and she described it as they pull your tissue out and then they run over it with a semi truck. And I was so scared to go and have my first mammogram. After hearing her description of what it was like, I was like, oh my gosh, this is the last thing I want to do. And I was in my early to mid 20s at that time. And so,
So
yeah,
you
like,
didn't.
what were the horror stories that you
Oh, the
heard
same
about?
thing. Just how painful they are. Just that they're excruciating and they're not comfortable. I'll give them that. They're not comfortable. But a pro tip would be is to try and don't schedule your mammograms around when you're ovulating. Your breast tissue is more
Yeah.
sensitive. You're more bothered by pain, or like your pain threshold is a lot lower. So try and steer away from those times to have a mammogram so that it's not so sensitive. It's pressure, it's uncomfortable, but it's not painful by any stretch.
And it really does only last for a few seconds. I think they have you hold your
Yeah,
breath
that well,
for what is
they
I
position
can't
you,
I can't remember how many seconds, but yeah.
and then they tell you to hold your breath because if any movement is going to move the x-ray from where they have it pointed at, and then they release it and then they may move it. But
Yeah, my first one, I was really nervous. I went to a hospital to have mine done, and I don't know, it was just really awkward. I didn't know what to expect. They didn't really talk me through it. They just kind of poke and prod you and pull you and put you into the machine and tell you don't breathe. But at the end of it, it was okay. I have found a better experience. You don't feel like such a number when I go to the mammo bus
oh, I've
or
never
mammo
done that.
trailer, I guess it is now.
Never.
Oh, you
So
should try it.
why? Yeah, tell me why you would
Yeah.
recommend that over just a normal.
I feel like there's not as many people there. You're not a number. You walk in, you get checked in, and then they give you a private dressing room, and then they come out and they take you back. I feel like it's a lot more one on one and less like you're a cattle
That you've
going through the
changed into their
slaughter.
special gown and now you're going to go back.
Yeah. I don't know. I just feel like it's just a lot more personable, less people there, all of the things. And I felt like it was a lot faster too.
Are there people waiting? Is
So
it like a
I don't know.
typical?
No, nope. They schedule it so that people are kind of in and out on their own. So yeah, when I've been there, there's maybe been one person, like when I get there, one person in getting their exam done. By the time I'm changed and ready to go, like that person's gone. So no, I've really only ever seen one or two people there at the same time, either before or after my appointment. So I recommend it. If you haven't tried it yet, I really do recommend trying it.
I like that. You know what? Are there such things as like a immunization mobile? Where we go and do flu shots, like a mobile. So that might be a good idea. You
I
know what I mean? Like a
I don't know.
mobile flu clinic that goes to our rural communities. And anyway, it's a side note, but
Yeah, I don't know if there's
there
anything
should
like
be.
that. I mean, they do flu shot clinics. Yeah, at the clinics, like they
Yeah.
have drive-throughs and stuff like that. But yeah, I don't know about a traveling bus. Maybe you could do that
Yeah, maybe.
and drive a bus.
Maybe so. So we both have daughters. Has your daughter had a mammogram?
No.
Nope.
Has
Nope.
yours?
When do you think you're going to recommend she have one? Just at the 40?
I mean, she's only 25 and I don't have family history that I know of. There's not any family history on her father's side of breast cancer, so probably 40 would be the
Yeah.
recommendation.
What do you think? I'm sure somebody can point me in the right direction, but where I haven't had breast cancer and it's my daughter's biologic or her maternal grandmother, should ask somebody about that, shouldn't I?
Yeah, I think if you've had the genetic testing
let's
and you
talk
don't
about
have the
that.
BRCA gene, she's probably not at
Yeah.
high risk if you don't have
Which
the
I
BRCA.
don't, because I did do 23andMe. So back to the insurance thing, I was afraid of insurance, like life insurance. So I never did do the BRCA test, but I did do it when I did my 23andMe. That was a part of it. So, and it did come back that I did not have it. And neither does my daughter. Yeah.
That's good.
So hopefully
That's
it's
good.
just something, like it was just an anomaly. It was just one person.
Yeah.
But it's a good reminder to have
It is a good
all those
reminder.
fun things that go on during October, right? The breast cancer awareness, and I know at some hospitals they're decorating bras for contests, like pumpkins. They're decorating them, and what have you heard of?
I have not heard of any other activities, but yeah, like the bra contests at the hospitals are the biggest ones that I've heard of, and just awareness, making sure people are aware of the risks and when to go and those things. So
there's a lot more out there than there used to be, and I think the more we can make others aware, the better, and including men. You did bring up a good point. This isn't just a female disease or a female cancer.
Yeah.
Get your breast tissue checked if you've got a history of it in your family. Men, look out for your men too, if they've pushed them to get a mammogram.
Definitely.
Are there any statistics, like if you have a mammogram, you're less likely, you know what I mean?
Here's some statistics. In 2024, the estimated number of breast cancer cases and deaths in the U.S. are just over 310,000 new cases in women and 2,790 new cases in men. They anticipate that 42,250 women and 530 men will die from breast cancer. That's quite a lot. But the 5-year survival rate is 91.2%.
5-year survival, really good. I really like that.
If we want to talk about equity, so interestingly, Hispanic women have 20% lower incidence of breast cancer than other groups, but they are more likely to be diagnosed with breast cancer at later stages. About 9% of men and 6% of women have metastases when they are first diagnosed with breast cancer, which means it's gone outside of the breast area. Here's a good one. The overall breast cancer death rate declined by 44% from 1989 to 2022. And then Black women have a 38% higher mortality than white women, despite 5% lower incidence. My advice would just be, again, follow your gut, go by your provider's recommendations. But if you are still feeling like there's something more going on that you just don't feel right about, it's okay to get a second opinion.
I like that message. Thanks, Kelly, for chatting with us today about breast cancer awareness.
Yes, thank you, and have a great rest of your day, and we'll see you next time. If you or someone you know has thoughts of hurting themselves or others, please text or call 988. They will direct you to someone in your community that can help. You can also call 911 in an emergency.
Remember, you never know what someone else is going through. Sending peace and love to all. Don't forget to like and subscribe to our podcast. You can also follow us on Instagram and Facebook.